Macro trends affecting the healthcare workforce in Greater Metropolitan Washington, D.C. In this extraordinary time, the main concerns for hospitals and healthcare organizations in the Greater Metropolitan Washington, D.C. area would depend on the local macro trends, including economics, demographics, personal lifestyle factors and behaviors, technology, and federal and state government policies. Economy is affected by the current COVID-19 pandemic, resulting in increased unemployment rates, but healthcare needs are expected to grow. Demographic shifts to increased aging population and more cultural diversity, as well as lifestyle factors such as smoking and obesity, are affecting the future trends and needs in healthcare. Technology is also evolving at an exponential rate, with increased reliance on such tools as cloud infrastructure, artificial intelligence, biotechnology, and gene therapy. We will additionally discuss government policies that will affect healthcare delivery in the metropolitan DC region. Additionally, we will analyze local and national healthcare job shortages, including proposed recommendations to alleviate these shortages. After that, we will discuss future job opportunities for healthcare managers that are related to the macro trends that we discuss. Employment of healthcare professionals is projected to grow 12% by 2021 as reported by the Greater Washington Workforce Development Collaborative. The economy in the DC metro area has numerous opportunities to not only create more jobs, but also generates investment opportunities in both the public and private sector for short and long-term profits. The United States of America has many large cities that are projected to experience long-lasting negative impacts to their local economies as an after effect in the ongoing coronavirus pandemic. Regional Economic Monitor System by the Council of Governments show an unemployment explosion of 9.9% just in the 1 month of April 2020 alone. Compared to the national unemployment rate of 14.7%, Metropolitan Washington's rate is lower, but still significantly more than it has been over the recent years. Healthcare is one main sector where there are opportunities for proactive economic growth and stability. The U.S. Bureau of Labor Statistics reports that in March of 2021, the Metro Washington area had 23,515,000 education and health services employees on its non-farm payrolls by industry sectors. The need for healthcare services is growing in the DC metro area, and opportunities are also in technology-related roles that can allow healthcare networks to expand to its full potential.
Demographics. Several macro trends have impacted the United States healthcare system and its workforce, including the aging of the population, changes to the population demographics, lifestyle choices, and individual behavior. The U.S. population is aging. The generation known as baby boomers, born between 1946 and 1964, have retired or are aging into retirement. Many physicians in the United States and nurses are part of this generation. Physician shortages are estimated to be around 100,000 by 2030, which will impact access to care. Washington, D.C. has one of the lowest local concentration of nurses compared to other parts of the U.S. Shortages of providers and nurses will negatively impact access and quality of care. An older population will also place additional strain on the healthcare system and its workforce, because most will have at least one chronic illness and require more complex care and treatment. Cultural diversity. The U.S. population is becoming more culturally diverse in its race, ethnicity, and religious beliefs. Healthcare will need to be more culturally competent. There will be much more emphasis on ethnic traditions, language, religious beliefs, and communication styles. In 2019, 56% of the active physicians were white. The foreign-born population has grown significantly since the 1980s, especially in Washington, D.C. As the population becomes more diverse, the students from different races and ethnic backgrounds who are applied to and graduate from medical school, nursing schools, and other health professional schools. Eventually, the healthcare workforce will become more reflective of the population it serves. Religious diversity will also increase. increasing a workforce religious diversity, and how medical treatment is provided to the patient. For example, end-of-life customs and traditions of different religions need to be considered in the care plan. Lifestyles and behaviors. Smoking and obesity will challenge the U.S. healthcare system and its workforce. There is a proven link between smoking and diseases. However, 14% of the U.S. population still smokes. Also, 1 in 50 physicians and slightly more than 8% of health professionals also smoke. There's estimated to be 19.7 million workers in the U.S. healthcare system. So that equates to approximately 1.5 million smokers. Smokers have a higher absenteeism rate and are less productive on the job, which could negatively impact the healthcare system when 1.5 million people are smokers and taking breaks or calling out. That could impact access to care and quality of care. Obesity leads to chronic diseases like high blood pressure, diabetes, and heart disease. Obesity rates in the U.S. have gradually increased over decades. 29 states have obesity rates over 30%, with a few approaching 40%. The remaining states are above 23%, with Washington, D.C. also about at 23%, which is better than 49 of the 50 states. Overweight or obese patients present additional challenges to the healthcare workforce because they are larger and heavier than most patients and require nursing staff to be more vigilant in anticipating obesity-related nursing issues. Nurses and other healthcare professionals have injured themselves caring for these obese patients.
Technology is one of the trends that it is and will continue impacting the healthcare system because it forces the traditional model to power individuals. Technology is impacting the DMV region by storing and sharing information, artificial intelligence, and biotechnology. Regarding storing and sharing information, a study shows that only 35% of the healthcare organization in the region has more than 50% of their data digitally and counts with their own cloud infrastructure. Therefore, it is crucial the implementation of the cloud system to facilitate interoperability and reduce operational costs. The cloud eliminates location barriers. Patients can have access to their health services and their health data. Providers can provide personalized care and facilitate telemedicine and post-hospitalization care. The second area is artificial intelligence. The U.S. healthcare system is moving fast to a value-based model where hospitals and physicians are paid based on patient health outcomes. To achieve this, organizations need to improve the quality and delivery of healthcare. The objective is to improve efficiency, and AI offers solutions that change how providers prevent, diagnose, and cure health conditions. AI can automate and remove redundancies from business operations. An example of this is a new platform called Indra. This platform can recognize, classify, and compare images for faster and accurate diagnosis. The third area is the biotechnology. Scientists are experimenting with gene therapy. This biotherapy uses genes to treat and prevent diseases and ultimately avoid drugs or surgeries. An example of this is the new mRNA vaccine that are used to fight the COVID-19. Scientists predict gene therapy will be the new way to treat infectious disease. Federal and state government policy. 5 areas where the federal and state government are impacting the DMV region are cybersecurity. The state of Maryland has been working on fully digitalizing its healthcare system. The state is working with the U.S. Department of Health and Human Services and the Office for Civil Rights to detect and investigate breaches. The report states that Maryland is one of the states with the most secure cybersecurity protection in the nation. In 2019, 500 breaches were reported nationally, but only a dozen happened in Maryland. The second policy affecting the DMV is the recent passage of the COVID-19 relief bill. This bill expands the HCAD and increases coverage. People that were not eligible to purchase insurance in the marketplace can have coverage now. Consequently, more people will be seeking healthcare services. However, administrators need to be prepared because this provision can generate a higher or lower reimbursement ratio for the healthcare organization. The ACA expansion could bring more patients with third-party insurance. However, it can also bring more sicker patients to the emergency department without changing the payer mix. This can affect negatively the healthcare organization reimbursement system. Another policy affecting the region is the Virginia Medicaid expansion. Nearly 138,000 people whose income was between 100 and 138 of the poverty level obtain coverage. It is expected that 423,000 more people will gain coverage by this year. The ACA expansion could bring more patients with third-party insurance. However, it could also bring more sicker patients to the emergency department. Without changing the payer mix, this will negatively affect reimbursement. For this reason, it is crucial that the organizations move to managed care, where patients use more outpatient primary care clinics. Another provision affecting the Maryland healthcare system is the Prescription Drug Affordability Board. The board reviews prescription delivery, payment process, and analyze data for drug pricing and utilization to create regulation that goes against the high cost of prescription. Also implementing the total cost of care model. The model provides primary care with tools and resources to help patients with chronic conditions to achieve better health outcomes. The fifth policy impacting the Maryland is the Hospital Patient Bills of Rights. Hospitals are obligated to provide a copy stating the 24 rights that the patient has. For example, the right to receive treatment without discrimination, informed consent, and privacy and confidentiality.
Employment shortage and how to deal with the shortage. Research has shown that by the year 2025, there will be a shortage of 20,000 primary care physicians, and by the year 2030, that number will also increase to over 121,000. In the United States, by the year 2026, there will be a need of over 200,000 nurses yearly to compensate for those nurses who are retiring or occupying new positions. These shortages will grow tremendously due to the fact that many doctors are continuing their fellowship programs, and some primary care physicians are also going back into the residency spots, taking these residency spots to specialize in different areas of medicine. Nurses, on the other hand, are completing higher education degrees such as Masters of Science in Nursing, which is MSN, or Doctorate of Nurse Practice, which is DNP. Medical students who have passed the United States Medical Licensing Exam, which is a USMLE, were not able to match with desired residency programs due to the shortage of Medicare-supported residency spots. Congresswoman Terry Sewell of Alabama proposed a solution that can help the doctor shortage. She stated that by increasing the number of Medicare-supported residency positions, you would get more medical students into these residency programs, and also at the very end, after 3 years of those residency programs, you would have successful doctors, and that would actually decrease the shortage of doctors. The United States has allowed foreign-trained medical doctors to apply for residency and practice medicine in the United States. Maryland Health Department stated it would give nurses who are working in the hospital and also in the state facilities a pay raise of 5.5% and approximately a bonus of 6%. Some nursing schools have offered loan replacements of $20,000 for over 10 years, or provided incentives such as paying for books or accommodations. These accommodations can range from housing or dorm rooms to those who qualified. And of course, it just depends on what state the nursing school is, and also if it's one of those community college nursing schools, or if it's one of those public nursing schools or private nursing school. So it just depends on every state and also every school.
Professional opportunities for healthcare managers include nursing home manager, diagnostic and laboratory manager, wellness program administrator, healthcare writer, supply chain manager. Considering that the healthcare needs of the aging population are increasing, it can be expected that more people are choosing to live in nursing homes. Nursing home managers will be needed for managing caregivers, patient and family orientation, coordinating clinical care, staying recent with local, state, and federal regulations, reinforcing accreditation standards, and managing employees. A laboratory manager oversees teams of scientists to further medical research, technology, and development projects. Their teams research and develop new vaccines, medical devices, and pharmaceuticals. Their tasks include working with company executives and government officials, allocating resources such as finances and personnel to specific projects, overseeing research projects, utilization of technology, and communication of research information to management teams. Wellness program administrators seek to affect change in their communities, and they are usually responsible for leading public health initiatives. They can target specific populations and demographics to ensure that organizations are meeting certain preventative or corrective goals. Examples of public health wellness program initiatives include addressing obesity, diabetes prevention, mental health support, or veteran services. Healthcare writers explain complex ideas and simplify them for regular people in more understanding language. They communicate the important points from complex medical processes and allow people to understand more about their medical needs or insurance coverage. Healthcare writers will need to know what information the audience seeks to read, utilize language that is relevant to the readers, comprehend healthcare topics, and keep content up to date and relevant. Supply chain managers try to find the best quality products and resources at lower costs. They will be responsible for optimizing purchasing power and interacting with other companies to find innovative solutions to shortages in necessary products such as PPE during the COVID-19 pandemic. This discussion of macro trends examined current and future factors that can affect healthcare delivery as it applies to appropriate skills needed for the healthcare organization to provide quality patient care. Population demographics, lifestyle factors, economy, technological growth, and government policies are important factors to consider when determining the needs of patient populations. The impact of the COVID-19 pandemic as it applies to the local economy, policies, and technology were analyzed. We also discussed current and future needs in healthcare, including management opportunities as it relates to these macro trends. The following slides are references for our presentation.